And here, my dear friends, is one more video for you. Don't forget to subscribe to my channel and share with a friend. Hey guys, here's Dr. Ray in a hotel room. I travel all over the world. I have clinics here in Florida. I want to talk a little bit about what people write into me. People have all kinds of questions, and usually they're very serious questions or they're beauty questions. Sometimes a little bit silly, but I try to answer them all. I think I'll preamble with this here, this little statue. So we've done several shows for the last 20 years, and fans are very interesting. They like to send me statues or paintings. So men send me paintings, women send me statues. The hair is very similar, you know, the classic scrubs without sleeves, and the classic choke I like to wear. What's missing? Mr. Happy. What's going on? Hey, you guys, I did my genealogy, classic Brazilian. I'm 17% African. I got a little German in me, lots of Spanish, Arabic, classic Brazilian. We're multi-racial. Well, the question is, speaking of Mr. Happy's penises, right? So usually I like to start with the ladder of decision, which means we start least invasive and work our way to the most invasive. I want to start backwards with the most invasive first. When I was a resident, I finished my training at Harvard Medical School. We did lots of penile reconstructions from accidents, farming accidents, so on and so forth. The Chinese microsurgeons, and together with American microsurgeons and others, have developed an amazing, it's called the Wang technique, that's one of them, an amazing reconstructive technique for the penis which has been avulsed, removed. They use the ulnar bone to any length. Patients always ask the whole length. Skin grafts from the buttocks. We use tissue from the forearm, the antebrachial nerves from the arm. In summary, we can make a penis which is erectile. It can micturate. It can ejaculate. It has rigidity, and it looks very much like a penis. Amazing where we are with science today. Let's talk about the cosmetic elements of penile surgery. We're working recently on liposuction, and we don't just do liposuction. We take out the fatty tissue, but we also use J-plasma to chisel the person. So they end up skinnier, tighter skin, and totally defined with the six-pack. We take that material, which of course is fat and fat stem cells, and if you retract the penis anteriorly, you find that behind the corpora cavernosa, anterior to the mons pubis and inferior to the symphysis, there's a potential space of about 100 cc. You inject, transfer the fat / stem cells to this area, and right off the bat, you get about an inch mechanically. However, we truly believe that the growth factors can influence the growth of the penis, and we have seen some great results with that. But that's very experimental. Let's talk about the time-tested technique, which is to divide the suspensory ligament. So here's the penis. It's a ligament that comes off your bones, the mons pubis, and half the penis is hidden around and behind the bone. You remove that ligament, and the penis gets gets 100% longer, okay? So half the penis is hidden. However, here's the huge however, surgery has risks: nerve damage, impotence, vascular problems. Remember, the penis is not well vascularized, which could lead to necrosis. However, infection. However, the one that really concerns me is that V2Y incision can contract. So your penis was already a bit short, and what's the average flaccid length of the penis? 3.5 centimeters. What's the length of the erectile penis as an average? Is 5.1. But there are racial, and there's some wonderful graphs in the internet can show you there are some racial differences. When I was in medical school, the longest was Germans and Africans. Have I mentioned my mom is German Brazilian and I have 17% African? True that, you guys. Penis can be how much lengthening can we get from dividing suspensory ligament, about half an inch to an inch. The risk that most concerns me, other than infection and neurological damage, is shrinking of the scar. Scars can contract, so you actually end up with a penis that is shorter. So let's talk about the homeopathic alternatives and home remedies, which is, of course, you guys know is one of my favorite areas. Let's go over some amazing herbs, which you see in some very commonly in the products that are very popular. Damiana. Many times they have a Greek name. Horny goat wheat. Yohimbin. Murapuama. Tribulus. Maca. Ginkgo. Are very common to many of these products which are available in the market, and these are the most common homeopathic herbs. Now here is home remedies. Did you know the banana, salmon, onion, and primarily because the complexes, the B1, B6, B9 complexes, can increase your penis. Exercise, because it makes androgen, increases circulation. Anything that increases circulation is going to give length. Just warming. Just people like living in places that are warm. They like to stay warm. Some people like cold. People that like to stay warm and live in warm places and so on and so forth, the penis responds to warmth and it grows.